If you're over 60 and your erections aren't what they used to be, this isn't just aging, it's not just stress, and it's not just hormones. It could be your grip. That one small habit, how tightly you're holding yourself during masturbation, could be silently destroying your sensitivity and weakening your erections over time. I'm Dr. Kara. I'm a board-certified urologist, and in this video, I'll show you how grip strength affects your nerves, your blood flow, and your ability to feel real pleasure even if you're perfectly healthy otherwise. We'll go over the warning signs, how to fix it naturally, and what to avoid starting today. Because at the end, I'll give you one simple test you can do tonight to find out if your grip is quietly damaging your erections.
Today, I want to talk to you, candidly, respectfully, about something most men over 60 have never discussed with a doctor, but absolutely should. Let's talk about grip strength, not at the gym, but in a much more private setting: masturbation. You see, grip strength refers to the amount of force used during self-stimulation. For many men, especially those who may have been relying on masturbation more often in later years, perhaps due to loss of a partner or changes in intimacy, it can become a deeply personal habit. But here's what many don't realize. When that grip becomes too tight, too forceful, it can start doing real harm. I want to be very clear. Masturbation is not the problem. In fact, for many older adults, it's a healthy and normal part of life. But when the grip used is consistently too strong, it creates unnatural stimulation, a level of pressure and friction that the body was never designed to replicate during real intimacy. Over time, this can lead to what we call penile desensitization, a loss of nerve sensitivity that makes it harder to achieve or maintain erections even during partner sex. It can leave you feeling frustrated, discouraged, and disconnected from your body. And many men think this is just aging, but it's not always the case. The good news is, this is completely preventable and, in many cases, reversible. By simply adjusting your technique and being more mindful of how you touch yourself, you can retrain your body, regain sensitivity, and even improve erectile function, all without medication. As someone who cares deeply about the well-being of older adults, I'm sharing this not to embarrass you, but to empower you, because you deserve to feel good in your body at any age. If this video helped you, please like and share it with someone you trust. Chances are they need to hear this too, and just like you, they might be too afraid to ask. Take care, and be gentle with yourself.
I want to take a moment to talk with you, man to man, doctor to patient, about something that's rarely talked about but quietly affecting millions of older men. It's about the way you touch yourself. Specifically, how much force you're using during masturbation. You see, as we age, many of us experience changes in sexual function. That's completely natural. But what's often overlooked is how one small habit, applying too much pressure or gripping too tightly, can quietly contribute to those problems. When you consistently use excessive force, you begin to overstimulate the nerve endings in the head of the penis. Over time, this leads to a condition called desensitization, where your body becomes less responsive to normal, healthy stimulation. What once felt pleasurable may start to feel dull, numb, or frustrating. It doesn't stop there. Many men begin to experience mild to moderate erectile dysfunction, not because of age or hormones, but because the body no longer reacts the way it used to. The nerves are less sensitive, the mind and body are out of sync. In some cases, this can evolve into what we call death grip syndrome. It's not a medical diagnosis you'll find in a textbook, but it's very real. It means you've trained your body to need an intense, unnatural amount of pressure to feel any pleasure at all. And that makes it difficult, even impossible, to enjoy intimacy with a partner. But here's the hopeful part. This isn't permanent. With the right adjustments, the body can relearn. Nerves can recover. you can reconnect with sensation and reclaim confidence in your body again. I'm not here to shame anyone. I'm here to offer clarity and compassion.
With a lifelong passion for helping older adults protect their health, dignity, and quality of life, today I want to speak openly and compassionately about a topic that far too many men silently struggle with: changes in sexual sensitivity and performance as we age. Now, here's the truth. Most men expect some shifts in their sexual function after 60, but what many don't realize is that certain subtle warning signs may be pointing to a deeper issue, one that's not just about aging. Let's talk about those signs. First, have you stopped waking up with morning erections? That early morning response is more than just a quirky part of male biology. It's a reflection of healthy blood flow and nerve function. When those spontaneous erections disappear, it may be a sign that your system isn't responding as well as it used to. Second, do you find yourself needing more pressure or more intensity during masturbation to feel the same pleasure you once did? That change could mean that your body is starting to tune out normal stimulation. Over time, the nerves involved in arousal can become less responsive, especially if the technique used involves too much force or repetition. And finally, perhaps the most painful sign, you're not feeling enough during real intimacy. You're there, physically, but emotionally, sensually, something feels missing. The sensations don't match what you remember. And maybe you've started to worry, what's happening to me? You're not broken, you're not alone, and you're not beyond help. These signs aren't failures, they're signals, and recognizing them is the first step to getting better. With simple adjustments and the right knowledge, you can restore sensitivity, improve performance, and most importantly, feel like yourself again.
Today, I want to share something simple, practical, and often overlooked, but potentially life-changing. If you've been struggling with reduced sensitivity or difficulty during intimacy, I want to talk to you about something called grip strength, specifically how you can test and adjust it to protect your sexual health. Let me start with this. The body is incredibly adaptable. That's good news, but it also means that over time, your body will get used to the exact way you stimulate it. And if you're using too much pressure during masturbation, it can slowly numb your sensitivity without you even realizing it. Here's a quick test you can do at home. No equipment, no awkward doctor visit. Try using just 2 fingers gently to touch yourself. If you struggle to feel pleasure or arousal with that light touch, it's not because you're getting old. It may be because your body has adapted to an unnatural level of pressure. That's your signal that it's time to make a change. So what can you do? Reduce the force you're using, slow it down. Use a quality lubricant to decrease friction and prevent overstimulation. Switch hands occasionally. It helps break automatic patterns. And most importantly, avoid tight, fast squeezing motions, which may feel good temporarily, but train your body to need more and more intensity just to feel something. The goal is to retrain your nervous system gently and gradually, so that normal stimulation becomes pleasurable again, and intimacy with a partner feels natural and satisfying. I'm sharing this not because it's easy to talk about, because too many good men are silently struggling, and they don't have to. Take care of yourself. You're worth it.
If you're watching this, you might be someone who's quietly wondering, can I really get back what I've lost? The short answer is, yes, you can. Many men in their 60s, 70s, and even 80s have told me they feel disconnected, physically and emotionally, from their bodies. They've noticed a loss of sensitivity, trouble getting or staying hard, or even a complete absence of pleasure during intimacy. And often they think that's just how aging works. But here's what I want you to know. While aging plays a role, you have more control than you think, and it starts with a few small, powerful shifts in your daily routine. Let's talk first about Kegel exercises. These aren't just for women, they're for you too.
Kegels strengthen the pelvic floor muscles, which are directly involved in blood flow, arousal, and erection control. Just a few minutes a day can make a remarkable difference in circulation and firmness. Next, let's talk about mindfulness and edging. In a world where everything moves fast, we often chase quick release, but that can lead to shallow pleasure and long-term desensitization. Instead, take time. Focus on the sensation, not the finish line. Let yourself build arousal slowly and allow your body to feel again. That's what edging is, and it's a gentle way to retrain the nervous system to enjoy the journey. Finally, and I say this with care, if you rely heavily on pornography, consider taking a break. Porn trains the brain to expect overstimulation. By reducing or eliminating it, you give your brain space to reset its arousal pathways, so real connection and physical touch become pleasurable again. You're not broken, you're rewiring, and you can heal. Take care of your health. It's never too late to feel alive again.
If you've made it to this point in the series, I want to thank you for listening with an open mind and, more importantly, an open heart, because I know this isn't an easy topic to talk about. If you're a man over 60 and you've noticed changes in your sexual function, perhaps you're not feeling as much, not getting as firm, or just not enjoying things the way you used to, it's easy to assume that this is just aging or that your testosterone must be too low. But I'm here to tell you that's not always the case. Sometimes the solution is far simpler and far more empowering. In many cases, it comes down to how you touch yourself, the pressure, the rhythm, the habits you formed over the years. And the good news is, these things can be changed. By adjusting your technique, by reducing the force you use, by giving your nervous system a chance to recover from overstimulation, you can begin to restore sensitivity, improve blood flow, and even bring back natural, spontaneous erections. You don't need to rely on pills or invasive treatments to feel like yourself again. You need clarity, awareness, and a little bit of patience with your body. The truth is, your body hasn't forgotten how to feel. It's simply waiting for a chance to reconnect, and with the right care, it absolutely can. This is about more than erections. It's about confidence and dignity, and your right to enjoy life fully at any age. If this video gave you something to think about, if it helped you feel less alone or more hopeful, I encourage you to like and share it with someone else who may be going through the same thing. You deserve to feel good again, and you're not alone on this journey. Take care of yourself. You're worth it. Dr. Kara.